for this event. And I also welcome our friend from the Mizoram and Nagaland who are participating in these discussions. And this is the first event I think we are organizing it. This kind of events will be the example, and which will set an example that this way we can discuss the things and then we can take it forward. So we look forward. I really look forward after the discussions, whatever the things coming out. We'll try to see how best we can incorporate and how best we can include those recommendations and suggestions. And we have representative from SACS, Tamo Abhiram is there. He will be very much helpful, and definitely he will take the points forward. And we have Srinivas ji, who will definitely do advocacy with the CDC as well as the NACO. If there is any important points coming up, I mean, really, if I miss Sanamacha, then it will be very distinct for me, because I just saw Madan's camera, his photo. So thank you, Sanamasa, for making it instrumental that you are behind with whole the program, whole TZ Health and Wellness Center, and other people, whoever who have given a lot of contributions. Like I definitely remember. I just want to remember Santapura also in this event, but her contribution is also very much important. So I'll not take much time. I'm very hopeful for this, and let's start the discussions. Thank you very much, and I welcome everyone again. Srinivas, over to you.
Hello.
Srinivas ji.
Hi, thanks Pankaj for your words of encouragement. And now that we have Tamo Abhiram's hands up and he's ready, I think we will now request Tamo to please give your blessings to this event, and like to listen to you. Abhiram?
I think we need to allow Abhiram.
Is
Praveen ji, Sweta ji, Abhiram. Yes.
Yeah, Tamo, you've been made the host, so you can now unmute yourself.
Dada, just unmute and try.
Hello. Yeah, Abhiram, you can. Yes, we can hear you. Yes.
Okay. Good afternoon. Once again, I want to welcome all our colleagues who are really moving ahead our program. I think today we are having this panel discussion on COVID-19 pandemic and what has happened, particularly in Northeast, in Manipur, Nagaland, and Mizoram. I think definitely we will have the sharing from our colleagues from Manipur. I know Ranjit and Bonita will be presenting, and Lipok from Nagaland and Joseph from Mizoram. I think though the pandemic is very, very serious, but our mental status is very, very strong. I can see many of our colleagues doing various activities. While doing that activities, some of us got this infection. Unluckily, some of them, they got illness and many of them recovered, but few of them, they could not recover and they died of this pandemic. But after that, I think now there are so many changes. People understand that this group of people, trans community, is also very, very important group. That's why in our local, media, local newspaper, even not only the center of the state, capital of the state in Imphal, but also in Kakching area, even trans community people were helped and they come out very, very proudly that they are also the citizen of this state. That's why I think today's panel discussion will be very, very helpful to find out those difficult areas and what are the activities they have done during this pandemic, and also what we are expecting is in Manipur, in Nagaland, Meghalaya, in Mizoram or Nagaland, we are expecting another wave of COVID, that is third wave. Manipur, we have already have the problem of black fungus. It's now a very frightening situation in Manipur. And very recently, our Honorable CM has announced that out of the 20 sample which was sent to Pune, 18 found out to be very this new strain, new variant, Delta variant. So Manipur, I think many of the people, they took very seriously, and that's why very recently Manipur SEX, ITEC, and Maruploy, we come together, and with the support of the whole staffs of Transgender Health and Wellness Center, Imphal, many of the trans community people, both trans men and trans women, they were given vaccination. I think like that kind of support from various angles, both from government and from the other institutions, it was a good, I think, example that we could do something if we go hand in hand. And today also we are organizing this under the support of PEPFAR. This panel discussion, I think, will definitely bring out some good solutions, good examples, how to again make ourselves, how to make affirmation, dignity, and equality, so as our visibility can be increased, and the innocent people should be safe from any kind of torture, any kind of marginalization. So today's program, I think after the discussion, it will definitely bring out good ideas. I think I will also try to give some inputs while discussing in this program. And I once again want to thank and welcome Avina, Srinivas, Pankaj, and all the team members here, and also friends from Nagaland, friends from Mizoram. Once again, I welcome all of you, and we will have a very wonderful discussion today. Thank you.
So Sanjeev, who will be taking our program forward from here?
We have to welcome Sana to take the lead.
Okay. Thank you, Tamo. Great to see you. And you have rightly said it's a huge challenging time now. And with this introduction and inaugural by Tamo Abhiram, I will now request our chief moderator, our great supporter and a great leader from Manipur, Sana. Welcome, and I request you to come and please take this event forward. Welcome, Sana, and good to see you.
It takes no compromise to give people their rights. It takes no money to respect the individual. It takes no political deal to give people freedom. It takes no salary to remove repression. With this note and kind permission from the chairperson, we'd like to commence today's panel discussion on any LGBTI movement and COVID pandemic and its impact in Northeast India. We have 4 prominent panelists. The first panelist is from Dimapur, Nagaland. He is single and a happy gay. He is graduated from NEHU He is working as developmental field under Sati for more than 8 years. Please welcome Lipok.
We should all at least clap. We can hear each other clapping. Abhi, unmute and clap for our panelists.
Our second panelist is working more than a decade in the field of HIV and gender rights, lead in LGBT-based advocacy in Manipur, is the secretary of first CBO in the entire Northeast India, Maruploy Foundation, a tireless and dedicated. Please welcome the secretary of Maruploy Foundation, my mom Ranjit. Our next panelist is the founder of Lone Star Society Mizoram, the first CBO in Mizoram, working as a counselor of MSMTI under Mizoram SACS, and also working as a community consultant under Solidarity and Action Against the HIV Infection in India. Please welcome Joseph. And our fourth panelist is a transgender rights activist. She is working as a center coordinator for Transgender Health and Wellness Center, implemented by Maruploy Foundation, supported by ITEC, MSEX, CDC, and PERFA. Welcome all the four panelists with a big round of applause. Then we will commence our panel discussion on Northeast trans movement and also LGBT community, and on COVID's impact in the entire Northeast. Please welcome all the four panelists once again. So welcome, Lipok.
I think Lipok is not here.
Sanamacha, Lipok is having some Zoom connection problem. So,
Okay.
and also network problem. So we can continue. In the meantime, when he comes, you can.
Hi, Jose. How you feel today? It's great. So we just want to know that, like, as you're working as a counselor, you're working under Sati as community consultant, you do an incredible job in Mizoram. So we just want to know that how can we improve this community empowerment towards the movement of building access to health and reduction of stigma and discrimination in next 1 year in Northeast India. So can you lay a few lines on this?
Thank you, madam. Am I audible?
Yes, yes.
Yeah. It is an honor for me to able to share this situation regarding Mizoram about the LGBT community. And thank you for inviting me. Thanks to Sanjeev. And let me start from the immemorial status, Mizoram. Let me say the Mizo society. See, Mizo society since time immemorial has been dominated by the patriarchal and conservative mindset. Those who transcend the normative gender and sexuality are stigmatized and alienated in the name of morality. The sexual movement elsewhere and the legal debate does not percolate to this stage as much as it does in other regions of India, leading to ignorance on the various rights and issues of the community among the population of Mizoram, including the community themselves. While in other cities of India, we are witnessing a queer see film festival like Pride March, etc. Our pace of advancement to liberation is such that we had only formed the CBO, which is called as Lone Star Society. As per 2011 census, there are 87% are conservative Christians here in Mizoram, while the door are more open with Supreme Court judgment on 2008 on Section 377 for those who practice alternative forms of sexuality. In Mizoram, the society uh, and religious institutions and the majority of the people who follow the conservative Christianity clearly label homosexuality as sin. The proceeding of Section 377 did not have much coverage in the media and daily discourse, so as to have an impact and to spread the awareness of the rights of the sexually marginalized sections. Uh, Please understand, I have much more what to share this situation. Okay. As you would, and let me say about the HIV issues also. Uh, uh, as you know, the Mizoram had the highest HIV prevalence among the states in India with uh, 2 point something percent, and also the records of MSMTI. I will share from my experience and from my record being a counselor in TI, the MSMTI. Our MSMTI project in Aizawl, there are 9.7% HIV positive out of 600 plus something registered clients. And the number of new infection case is still increased among the MSM community. There, it was the new infection case in 2020 and 2021, it was 1.2%. So unsafe sex is the main cause of spread of infection. So we need more effective and systematic awareness on sexual health, including STI and HIV among the MSM community.
Yes.
So
yeah, we all love to hear the story that we have never heard about this HIV prevalence and new infection, and about lack of effective awareness for HIV, and about you are talking about the morality connecting to the homosexuality, and also you have said that about 87% of the people in Mizoram are associated with this conservative idea. So we all collect the information, and what else you more to say that in order to better access to health and reduction of stigma and discrimination in the entire Northeast, what we as the community people can do. Can you please lay some lines on that?
So let me talk again about the HIV issues and okay. After that, I will talk about the stigma and discrimination. So, current HIV prevention intervention for MSM in Mizoram are primarily focused on condom distribution and HIV education alone, but do not address the many psychosocial problems that impact this population and may increase HIV risk to a higher risk. That is one of the main challenges here in Mizoram. As you know, from the NACOL guidelines and the Mizoram sex guidelines, there is only focus on condom distribution and HIV education, not address many psychosocial problems that face from the community that impact this population and may increase HIV risk. So, and I want to let me share about the stigma and discrimination. The community in Mizoram are extremely marginalized and stigmatized, and face many sources of psychosocial stress, including stigma, homophobia, discrimination, and even harassment. while the communities like MSM community sexual activity is prevalent in the state, such sexual behavior is taboo, influencing the community to be largely secretive and silent, and it placing them at risk of substance abuse and unsafe sex. So unsafe substance abuse is very high in our community. And the community of MSM community, am I audible, madam?
Yes, 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 you're audible.
My network is unstable because the weather is not good at
So
all.
there
It's
is no
raining here.
interruption. There is no interruption. Your voice is quite loud and clear.
As I told you before, how to cope with stigma and discrimination. Yeah, MSM community of Mizoram facing a variety of psychological problems, including low self-esteem, internalized homophobia, difficulty in coming out to others, family pressure to marry and have children like that. Due to such multi-level psychosocial stress, the community may also experience high rates of psychiatric disorders. It places them at greater risk of acquiring HIV. Due to the extremely stigmatizing cultural and religious context, the subsequent high rates of mental health problems, and the community in Mizoram might be experienced even more psychosocial distress than the community in other regions of the country, which may further potential HIV spread in this group. Then, yeah. Do I capture your question?
You are quite, I mean, we are quite happy to hear all these stories that we have never heard that what is happening in Mizoram among the community. But then you just put a remark on that. How can we strengthen this health system in Mizoram, especially for the LGBTI community? What can we do to improve their health access to health?
As I told you before, we in 2017 we formed a community-based organization for the first time in Mizoram, which we call Lone Star Society, and we are trying to cope the lifestyle and what I'm saying. Discrimination and marginalized community. So it is very hard to work in Mizoram. We had organized small workshop for the community in collaboration with some NGO like Hamza for Charge and the other NGO with from the other states. So and we organize workshop for the university student regarding the orientation workshop about the orientation of LGBT sexuality and gender issues, and with the National Christian Council and our CBO organized in 2019, I think. We organized a workshop for at Ijol Theological College for the student of theology. But it is very hard to do work in the Mizo society regarding this sexuality and gender issues, because as I told you, about 80+% of the population are conservative Christians, you know. So it is very hard to work.
Sure. But then it's clear that you are still working hard to gain the community acceptance, and you are trying hard to gain acceptance from the various stakeholders and from the various sections of people. So we're glad to hear a story that how this Lone Star organization were established, and we just learned that we need more workshop and observation of Pride month, and then the other activities in and around these theological colleges, which are highly required to get an access to better health and this reduction of stigma and discrimination in Mizoram. Thank you, Joseph.
Thank you.
So we now coming up to Bonita Pevam. So Bonita, we would like to know that what are the components of wellness center has provided during the COVID pandemic in Manipur or other states of Northeast, if you have.
Yes. First of all, I would like to thank all the participants. I mean the panelists, my friends Ranjit, Joseph, Lipok, Ao. All are my colleagues, and I would like to thank the technical supporters ITEC India, and special thanks to the state team and the national team, Sanjeev, Madan, and Abina, and CDC, Tamu Srinivas, and all. And regarding the services that we have given during the COVID pandemic, we are doing a lot, but it is everything is up for the welfare of the transgender community. And I would like to begin from the journey, from the problem that the community people have been facing during the pandemic since last 2 years. That means the first outbreak of the COVID-19 pandemic. And the main issue that the community people are facing during this pandemic is for livelihood, health, access to health, access to livelihood, and affected to the economy of the gender and sexual minority community. So in terms of accessing health, people are getting so many challenges and problems. And usually since the beginning of the, before the pandemic also, people are, transgender people and gender and sexual minority people are not properly seeking their health needs, and they are not accessing the health facilities. So this kind of lack of accessing to the health services, as they already living in a major condition. They are not treating the health condition that they are health problems they are facing, that they keep untreated. Such kind of untreated condition make the community worsen in the future. But again, in the COVID-19 pandemic, even though few of the community members want to access the health services and even want to consult the doctor and all, they are not able to access that services which is provided by the government of India and government of Manipur for during the COVID-19 pandemic, like it is Sanjeevni or the website, the government website for seeking health services, for the free consultation to the health consultants. And because they are very much, they are not well aware of how to use that equipment, how to use that link, how to consult, and all the process is very difficult to the transgender community because they were not so skillful and sophisticated to the computer and mobiles and smartphone and all. So and another one most biggest challenges is the mental health issue. Mental health issue is the biggest challenges during the COVID-19 pandemic among the transgender and the other gender and sexual minority communities, because most of the time they are not know themselves that they are facing the mental health issues. They are suffering from mental health problems and the mental health the kind of issues that after the critical, after showing out the critical symptoms of the mental health problem, they come to know and they seek help from the doctor. But at that time also they are not accessing the proper healthcare services from the right doctor, their access to the different doctors, specialists like heart, medicine, and all. After not able to treat their conditions, lastly they refer to the mental health, and the mental health is referred to the mental what can I say? Oh yeah, mental health professionals and the clinical psychologists and all. So this is the very big problem. And one example which I came across during the pandemic is I was also infected with COVID in last year December, and at that time I was very in very bad condition. My mental health is very affected, and I was not able to access the health services at all, and I was doing quarantine at my home only. So at that time yeah, the government people are asking me, are calling me, and they are monitoring my health, they are monitoring my mental health condition, but they are not understand what my gender is. They treat me as a male, and they are not knowing my underlying issues that I have been coming across as a transgender persons. So as a trans person, I have been facing many challenges in my coming out process too, as till up to now, even in the society, even in the family, and even in the partnership, even in the love relationship, even in the public places, also in the society itself. So there is so many underlying issues that hurt in my mind, and that make me worry when I was lonely, when I was feel lonely and I was alone. So such kind of issues that have underlying and that has affected previously since years long, and also coming up and also reflected at the time of COVID-19 pandemic infected period, during my quarantine period. And so, but the Transgender Health and Wellness Center is also setting up in the March of 2000, this year in the March of 2011 is inaugurated, 2021 is inaugurated on 25th March, and from there we are getting up to work on welfare and the health issues of the transgender and other gender and sexual minority communities, and we are giving many services to the community in terms of health and welfare measures, and we are also giving them the nutrition support, not nutrition, it is the ration support, COVID ration support. We are mobilizing when our transgender health and wellness staff are in taking the priority to provide the fullest needs of the communities, and they are mobilizing. I myself, in collaboration with Amana and other CBOs, Maruploy Foundation is also one of the CBOs that mobilizing the resource and then distributed that commodities or mobilized commodities to the transgender community of the Imphal East, West, Thobal and Bisnupur. We have covered around we have conducted 3 phases of ration and commodity distribution program, and in that program we covered more than 1,000 transgender in the entire district of 4 districts, Imphal East, West, Thobal and Bisnupur. So beyond that, we are also providing our mental health services. And I would like to say that in our Transgender Health and Wellness Center, we have mental health professional, clinical psychologists. Through our clinical psychologists, we reach out to each individual who register and unregistered community of our state, mainly from the Valley district, and individually reaching out to the mobile and the virtual platform, and through the conversation, our mental health counselor and our peer counselor reaching out to the community and checking their mental health status, and their checking their day-to-day behavior. Behavior means their sexual health behavior and the mental health issues. Also, they are checking their psychological status, and so this is the so as of now, I will tell these things.
We also saw that you have started this vaccination program in Manipur among
God.
We saw in social media, we saw in newspaper, and then in news of this other visual media. So can you elaborate on that, on how we have started it, how is your journey for that?
Okay, thank you, my sister Sanamasa, for reminding me that things. Yeah, this is one very unique and very specific program that has been taken up under the Transgender Health and Wellness Center initiative. And the Transgender Health and Wellness Center staff, and even I myself, and the implementing partner Merploy Foundation, and in technical support from ITech India, we are submitting a letter to the Mission Director, National Health Mission, State Mission Director, National Health Mission, and we are seeking approval from him that to organize a specific or a separate vaccination program for the transgender persons, because many of transgender persons are reluctant to go out from their home and to take the vaccination, and the nearby PHC centers and CACs, which is authorized by the government for the vaccination of a local. So they are not they are facing many problems and stigma, discrimination, and the unfavorable treatment from the society and the people surrounding neighborhood. So they are reluctant to move out to the center. And so by seeing that condition, in consideration of that condition, we are applying that letter to the, submitting that letter to the state national mission director of the state. And then he also approved the letter which is circulated from the social justice and empowerment for organizing such program. It's also one of the supporting document in that letter. And lastly, he approved our proposal, and he again directed to the district family welfare officer Impal West. And we also having a series of intercourse, series of discourse with the district family welfare officer regarding these. And in the initial period, they approved only for the 45 above. But at the time, from the government side, it is already ordered to get the vaccine, to initiate the vaccination for the 45 below, 18 above. And but they don't want, they also did not take up at the point of time when we applied the letter. But with the help from the MEX, Tamo Abhinam is the one of the point person who is very taking who is taking a lead role in conducting that vaccination program. We are doing series of discourse and the talk on the day of vaccination started initial stage, and we covered 51 number of transgender from Impal East and West in the 4 days. It was started on the 1st of June and continued till 7, but 4, 5, and 6 is not happening at the for the vaccination, and only 4 days is conducted. During that 4 days, we covered 51 numbers of transgender community. That's all. Thank you.
Thank you, Bonita. So we come to know that many of the mental health issues are not considered as an illness or that need to be treated. So that is why we refer them to the cardiologist, we refer them to other doctors to get proper medication or to get treated. But however, we are very lucky that we have a clinical psychologist available in this health and wellness center in Manipur. And I hope that this many of the mental health issues facing during the COVID time and after this post-COVID, I think the community can really get the benefits of it and really get rid out of these mental health issues they are facing. Thank you, Bonita. And thank you, State Mission Director NHM, for their initiative to get all transgenders vaccinated and give a designated program for that. So let's, so I request Ranjit to speak on how the sex is supporting the well-being of transgenders and other LGBTI community during this COVID situation in Manipur. I request Ranjit.
Thank you. At the outset, I offer my heartfelt thanks to my panelists and moderator Sanamasa, Manipur Sex officials, IT officials, CDC, paper officials, and all the community people viewing this YouTube channel or live telecast. So far as I know, since the very beginning of the initiations of the work done by the Manipur Foundation in the state of Manipur, Manipur Sex, especially Tamo Abhiram, has been helping from a long time back for the welfare of the community. So I really again appreciate Tamo Abhiram for his kindly and positive help extended to us. So in this pandemic situations also, as Bonita rightly pointed out that at the time of vaccinations in vaccination center, we have some arguments with the officials of the vaccination center regarding the authorization letter and authorization signing of the vaccination permit. At the time, we personally called to Tamo Abhiram. Tamo, there is an issue, please come, please come. And immediately Tamo Abhiram come to the center and he personally talked with the official of vaccination center. After that, the agreements was come between the vaccination officials and that and us, and started the vaccination program among the transgender. It is the remarkable day. It is remarkable point, I should say. So as Bonita saying, around 61 trans community have vaccinated. After that, we also request Tamo Abhiram and the mission director to continue the vaccination program to other districts like Bishnupur, as the community demand is increasing. So some trans community from Bishnupur districts almost complaining us why that kind of vaccination drive does not happen at Bishnupur district. And at the time I replied to the community, wait. You should wait only 2 or 3 days after the vaccination programs is wind off at Imphal. We compulsorily went down to your district and will start the vaccination programs. Don't worry. So, and I almost talked with Bonita. Also, Bonita, as community demand, we have to do so at the Bishnupur district. So, Bonita personally go to the mission director's office and take some size approval to do the vaccination program at Bishnupur District Hospital and CIC Moirang also. But as the rumor that comes from the social media, the side effects and some kinds of what to say, the fear and psychosis regarding the vaccination side effect, some community also asked me, so we can't do vaccinate because of the rumors that comes from the social media. At the time, I almost convinced them, don't trust on that rumor. Don't trust on that rumor. You should be vaccinated. Vaccination is very important for us. So like that. So not only vaccination programs, Tamo Abhiram, especially Manipur 6, Madam Project Director also very helpful to us for the initial stage of the Transgender Health and Wellness Center at Imphal, say from the beginning till the inauguration day. Madam Project Directors also extend her full support to us. So not only Tamo Abhiram, Project Director, and almost official of the Manipur sex come to the center for visiting regarding the completion of the structure, completion of the center designing, and also they almost come to the inauguration day at the Hotel Classic. So I always thanks to Manipur sex and Tamo Abhiram and the Manipur sex. I think not only to Module Foundation, they also supporting to the CBOs like NGO, I should say NGO, that there is a small component of the MSM DI project. In that program, also Tamo Abhiram is very helpful. And Susanpur also implementing MSM program done by the Salom, and the MSM DI project also implemented at Thoban by Craft. At that community also Tamo Abhiram extended his kind support, I think. So this pandemic, we should take help from the concerned authorities like the Manipur State, ITEC, CDC, PEPFAR, whatever we need. So we have to take ready. We have to take ready what kind of activities, what kind of mechanism, what kind of strategy to be taken up for the welfare of the community. so far as I should say regarding the support system taken from the Manipur state. Thank you.
Thank you, Ranjit. So when we're considering the community work here, we already get support from MSEX, starting from the project director and joint director, and every staff of SEX is very important and are very helpful in especially in this COVID pandemic. And I also heard the story that we are whenever we are being caught by policemen at the frisking sites, and they have to issue an order. And whenever we have a problem, yes, we also had a story. So can you highlight on that also, like how we are from that?
Yes. See, in the last year, past COVID wave, so, say we Manipur team went down to Bishnupur district for distribution of ration items. After went back from Bishnupur district to Imphal. Say what to say the area, the Kasampat junction, Kasampat in Imphal city, there was some police patrols. They stopped us because of not producing I-card and all. They asked us, where have you gone? Where have you all gone? We replied that we have gone to Bishnupur district for distribution of ration items to the transgender community. We don't want to hear that. We don't want to hear that. You should get on from the car. You should stand at the roadside. So at the time, we called personally to Tamo Abhiram. Tamo, there is the issue at the Kasapan junction. Tamo, please help us. Immediately, Tamo Abhiram called to the police officers, and Tamo told to the police officer regarding what we have done at the time. At the time, personally, police officers asked me, who is that? Go. Okay, go. Like so many issues that happened in the past wave, and almost issues faced by us. We again and again called to Tamu Abhiram, and we almost taken from help Tamu Abhiram at the time also. Thank you.
This is all assistant from the SEX. You can consider.
Yes.
So I think Lipok is joining us. Lipok.
I think Lipok has left because he has some technical issues in connecting.
So we want all the moderators to speak 2 lines on how this Northeast LGBTI movement differ from LGBTI movement in race of the country. So we'll start from Joseph. Joseph? Sorry, we'd like all the panelists. We'd like all the panelists to speak on how this Northeast LGBTI movement different from the LGBTI movement in race of the country. We'd all like the panelists to speak 2 lines on this. So we'll start from Joseph. Joseph? Yes, Joseph. So we'll start from Bonita. So Bonita, you speak on that, how this Northeast LGBTI movement differ from the LGBTI movement in the rest of India. In 2 lines.
Yeah.
Yeah, Joseph.
Yeah, am I audible?
Yeah.
Please, I don't get your question, please.
Okay. How does Northeast LGBTI movement differ from the LGBTI movement in the rest of the country, or you can take India?
So actually, we are different from the entire from the state of the like the central part of and the part of India. We are different in culture, traditions, and lifestyle. We all different from the entire part of India. So so as I told you before, see, uh, especially from Mizoram, uh, there is like actually there is no actual movement of LGBTQ till today. So we just started the community-based organization. So, but we don't uh, see. I want to let me tell you one thing. Last month, I asked. I have a question to the State Legal Service Authority, Mizoram, regarding the trans community. Uh, is there any government provision for a trans community in Mizoram? I asked like that to the Salsa Mizoram. They replied me like there is no government provision for trans community and the LGBTQI community because there is no official uh, records uh, and there is no trans community in our state. They replied me like that. So uh, we need a reliable statistic of trans community in our state first. And after that, we develop a road mapping for the trans people, I mean the trans community within the state. So there is very hard to work and to take a step for movement for the community. That's all.
So we'll now move to Bonita. So Bonita will speak on that.
Please unmute.
Yes, thank you, Sanamasa. As we are living in a geographically isolated area and the region, and we are in the conflict ridden situation of the Manipur, we are not able to get and access all those informations and everything. But actually, to compare with the other mainland Indian, Manipur is somehow comparable in the LGBTIQ movement. Manipur is active in some extent. We are achieving and we are in the race of the LGBTIQ acceptance, and but we are living in between of the society and the law. So sometimes we are very in the conflict situations. And in conflict situation, I mean, so if we are need to access the law, and sometimes law is not applicable to the customary law also, we are in the middle of that. So we are very sometimes we are how to say, we are not approaching to the higher legal bodies and the higher higher political bodies also, and impact of the political bodies is not remarkable as of now, but we are approaching this time, and I think in the future we will be achieving that much good. Yeah, and I will set something means that unlike with other community member who are living in the other state, other part of the country, the community peoples who are living in the Manipur, they are living in the hand to mouth existence, and they are the breadwinner of the family. And but family also use them as an added tools of earning money. So sometimes they are very they are in force of earning money and earning livelihood. But in the other states and other part of the country, transgender persons are what to say, they're staging out, they are secluded from the families, and they are taking shelter at the Gharana system are there. But in Manipur, Gharana system is not there, but beauty parlor is one of the like that system. But if a young transgender person is kicking out from a family or by the parents or some their guardians, they will take shelter from at the beauty parlor, and they are employed as the beauty parlor, and they earn money at even though it is very minimal amount. So yeah, it is very good. The initiative that has been taken in Manipur beauty parlor is the stereotyping and the traditional earning ways of transgender women in the state, and and it may be good or it may be bad. I can't say, but somehow it is good. It is helping to the community in their economy life. And for the trans men also, they are employed. Most of the transgender men are employed at the security job also, even in the hospital, even in the even though it is a formal or informal, they are employed somehow with the minimal pay of amount of pay. So yeah, such kind of initiative is already taken since past 2-3 decades. As of now, we are advocating with the stakeholder and with the political bodies and with the different part or different departments to understand the issue of transgender and LGBTQ peoples, and to understand their issues, and to implement that the country's legal bodies and the country's authorities has directed to the state. But as of now, nothing is happened. The transgender welfare board is already setting up. Manipur is somehow in the second or third in the entire country having a welfare board for transgender, but it's not functioning at all as of now. We are having talk with the state social welfare department, which is the nodal department of the welfare board. Manipur State as Control Society is one of the gadget department under this welfare board, and it is also having some role. I'm very proud that to be part of MAX now. And last time I was working with the national NGOs and the community-based organization. At that time also, I was advocating with many stakeholders and the government bodies for this functioning of the transgender welfare board. We are continuing. Once this prevailing scenario of COVID-19 is resumed to the normalcy, we will start again. Thank you.
Yes. So we'll now move to Ranjit, that how the LGBTI movement in the Northeast is different from the rest of the country movement.
Regarding that, in my conscience, the different movements from mainland Indian states and Manipur is somewhat different in terms of the approaching system by the community to the line department of the government. I think, in Kerala, Odisha and Andhra Pradesh, their government has launched the transgender pension scheme. Those transgender who cross 50 years or 60 years, they can get 1,000 or 1,500 rupees per month as pensions from the government. This is a very good, remarkable steps taken by those 3 steps. So it is. I think it was because of the community voice that have shouted in time. So like that in Manipur too, we have to raise our voice in order to get such kind of pension. Not only pensions, I think some states have started scholarship amounts, say 1,000 to 2,000 for pre-matric scholarship and post-matric scholarship from the government. That's also very unique things, I should say. In Manipur, we have to approach to the government in order to get some kind of support. That is the advance that has seen in the mainland India. So, in other way, in Manipur too, we have done so many good things. As Bonita has said that Transgender Welfare Board has formed. I don't know whether it is functioning or not, but it is good to form the welfare board for transgender. We can push to improve. We can push to work again for the welfare of the community, and we have the Thabal Songo for transgender community in the state of Manipur. every year at the time of Oli Yoksung Festival. So almost transgender transwoman community participate at the Taban Songba, and all the cisgender men, like men and female of the community rushing up and turn up to the Taban Songba to look the beautiful and the generic and uniqueness of the trans women's activities in that Taban Songba time. At the program, I should say it's really crowded. It is really crowded. Even MLA and minister also turn up to visit the Trans Taban Songba. It is the benefit of us, I should say. At the time, no transgenders were harassed. They appreciate what a beautiful, what a beautiful, what a beautiful, so beautiful is like that. And also we had organized transgender beauty queen contest in Manipur. It's the first time, I should say, in the Northeast, or it may be organized in the mainland India before, but very largely, very vastly organized in Manipur, I should say. In 2012, 13, 14, 15, in consecutively 4 years, we had organized transgender beauty contest. Not only showcase of the beauty days of the transgender community, we have shown, we have raised our voice about issues and challenges that we have faced. See, at the time of Section 377 repealment and the undergoing in the Supreme Court and the Delhi High Court, we used placards by the contestant of the beauty pageant. All the contestants hold a placard regarding the IPC Section 377. Go back 377, go back 377. This is the British colonial law. This is outdated law. We don't want such kind of law like that. Almost community use placard and in the standing on the stage. At the time, so the audience were crowded, we clap. It's very nice. It's very nice. This is also a opportunity for us. So we have done so many kinds that does not have seen in Indian mainland states, and also I heard around few weeks ago a transgender woman, transgender cell in the Manipur State Women Commission's office. I think it is initiated by Amana. It is also very good. The transgender community, if transgender community have any issues, they can rush there and they can take help from the women commissions. So this is also a unique thing, I should say. And Sumangila is popular art form in Manipur. Say in the female part, almost taken by the Nupi Manbi, Nupi Sabi, like that. Some general people Nupi Sabi, but among our community, Nupi Manbi. So I should say, lots of trans women community acted the key role in the Sumang Lila that is accepted by the society. That is also a unique thing of the Manipur. So in parallel, we have to do something to get more acceptance from the society, from the government. In parallel, doing by the mainland India, we should not set back. But in the movement of the national level and any kinds of the program, network, and any kinds of things that make in the mainland India is often neglected in the Northeast people. But in my conscience, I should say today's moderator Sanamasa is one among the National Transgender Council member, and I should say Santa also from Amana is also a well-known activist from Manipur. She is known by the mainland India, and And besides that, in Manipur, Atama, the CBO for the trans men community, all Manipur Trans Men Association has started working for the welfare of trans men. This is very unique one. And there is also CBO ITA, Empowerment Trans Association, is also working for the welfare of the trans men community. This is also a unique thing. So in this tiny state of Manipur, say we have some CBOs working for the community. It is a very good, I should say. So at last, we should approach to the government line department, to the concerned authorities, to get pensions of the trans community, to get benefited of the trans community for the welfare and for the well-being of the trans community. We should not set back. Thank you.
Yes, as our Chief Functionary Ranjit also said about the unique things of the Manipur, and I would like also like to add one point that Manipur have achieved. In fact, Manipur is very progressive in the LGBTI movement. I think in the entire country it was in the fifth positions or third or fifth position. It might be. I was came across once in a paper. But actually, the one thing that we have achieved in our specific state is the inclusive of transgender and the transgender persons in the pre-legal act, what to say, provisions. Legal or pre-legal aid services can be accessed from the National Manipur State Legal Services Authority. It is already under the Gazette of State. It is one of the achievement that we have achieved. Regarding that, I also like to thank the Amana and the Sati also. If I not thank them, I would not be very generous. So this is the one point. And yeah, we have the many unique things. Unlike even in the Northeast also, Manipur is in the front of the LGBTIQ movement. Yeah, everything is covered by the Secretary Ranjit. Yeah, we can continue. Yeah, over to Sanamasa.
Sanamacha, I just wanted to add that from Nagaland, the person whom he was having connection problem, but Lima is there, somebody, Imsu is there from Nagaland. Even I think Anna is also there. So 2-3 persons from Nagaland, somebody can translate because Lima is not very good in means in English, but I think she can speak a little bit Nagamese and Hindi. She can speak mixed. You can. That's just for your information, Sanamacha. Yes, thank you. Sanamacha, you have to unmute, I think.
Yeah, so it's good that we have representative from Nagaland, and it's glad that a few community from, even though we have a less number, that at least we have a community representative from the Nagaland in this panel discussion. It's quite privileged for the team. So who will speak? Lima?
लीमा आप अनम्यूट करके बात कर सकते हैं हिंदी में बोलने से प्रॉब्लम नहीं है
give us 2 seconds.
Okay, no problem.
Yeah. Pravinji, can you please make a co-host?
I'm unmuting her.
It is not required. Mic is open for everyone.
Okay. Then she can unmute.
लीमा आप अनम्यूट कर सकते हैं
I think Pravinji आपको करना पड़ेगा.
I'm asking to unmute Lima, but
अच्छा,
I
हो
think
रहा है।
somehow she's not able
लीम
to.
जी जी लीमा जी, वहां पे ना स्क्रीन पे आपके लेफ्ट हैंड साइड में कहीं पे माइक का एक बटन होगा, देखिए माइक जैसा, उस पे बस क्लिक कीजिए। Maybe there's some network issue.
Yeah, Lima, can you hear us, Lima? Lima, can you hear us?
So she's not able to unmute herself, so we have no clue. Chat box में डाल सकते हैं मंडी और नूपा मंडा। एक मिनट।
I think we can go ahead with further. Meanwhile, Sana, till the time we keep doing this, maybe you can continue the discussion, and then we will try to unmute.
Fine.
I think we cannot wait. Let's move ahead. Shweta ji, can you check? Praveen ji, can you check if it is possible for her to unmute till the time I think Sana takes the forward discussion?
Absolutely fine. Please carry on. I'll try to close.
Yes, Sanjeev sir, thank you.
I think there is a question in the chat box that the panelists might want to answer.
Sana, please continue. And in the meantime, I'll check and let you know.
So we will have so we will start community interaction. So you may ask question by unmuting your mic, or you may chat in the chat box. So we have one question from Santa Kurai. She asked, "How do?" Yeah, I'm reading it. So how do transgender? There is a question in the chat box.
Yes, how do Transgender Health and Wellness Center plays its position to maintain the cultural sentiment of Nupi Manbi and Nupa Manba of Manipur? Okay. Do I have to answer, or Ranjit, are you willing to answer this question? Okay, let me answer. Now, yes, Santa. Yeah, Transgender and Wellness Center. It is an initiative to ensure the welfare and the health issues of the transgender community. We will never go against the community standard. We will maintaining those cultural ethics and the cultural traditions and cultural things that the community have been maintaining since last decades. So when we talk about the cultural ethics and the cultural sentiment of the Nupi Manbi and Nupa Manba, we are living in a society where but I also already talked that in the society we are having a culture of beauty parlor, and the beauty parlor, that culture is that in the culturally we are also deprived at some extent, and we will have to extend our that possible help to the community, that even last time also, even in the cultural space also we are being secluded by those group called Fed organization, and sometimes it is also very challenging to the community. As a community person, as a community activist and a leader, I am also facing very challenging in the society, that in the society many organizations, other faith organizations and the religious organizations are banning our trans community to enter into the cultural and ritual places and to enjoy our life to the cultural places. This is one of the most challenging part. We will try at our best to maintain them and to our and to help the community. Yes. That's all, Ranjit. You can also supplement. I have.
Yes.
And another thing that Even in every program that our center taken up, we include the cultural things. That even in the transgender wellness inauguration functions of the transgender health and wellness, also we include our cultural program that performed by our community only. This is the one example. We are maintaining our cultural things also, and we will try at the best level to include our cultural ethics and the cultural things and the traditional things. Yeah, that's the one example. And like that, in the future also, we will join every initiative taken up by the community leaders, and we will always support it.
So any other questions from the participants?
Yes, there may be many things that we are not able to take at the one time. We are not able to take up what we are not able to do at the one time. But yes, this is the thing. And many questions are coming up in the chat box. But yes, yeah, community in this related with the sexuality and gender. This is that's a community in this sexuality and gender identity. Yes, of course, somehow it is related. And we are living in the society, very conservative society. How we have to challenge our identity. We have to fight for our identity. Faida is the one of the subject that we are having discourse on this to find out to track the history of the existence of the non-binary history of the existence of the sexual and minority communities and the gender non-binary people in the state. This is one example that we found in the history, in the indigenous books and the indigenous tales. Also, we found that kind of existence or that kind of execution even in the royal places, in the royal court. Also, there were evidence of employing those gender non-conforming people. Anybody can, we have to go, or we have to move on.
The question in the chat box, or anybody want to ask question? Unmute and you may ask the questions.
iPhone below.
Sana.
Yes.
So one thing what I like to add here, thank you, because if anybody is, I just said anybody wants to speak up, they can come and they can unmute and speak. What I wanted to really tell that one thing what I really felt, because when you really want to fight with the means fight for your rights, in the same way what I feel that we require a balanced approach where we only if we one way we are talking about inclusiveness, and in the other way we are excluding the people who want to come and join us. So just a second. Yeah. Sanamacha, if you can unmute Pankaj. ये प्रवीण जी पंकज को unmute कर दीजिएगा. And so what I wanted to just add that we really require to work. What I find, one simple thing I wanted to add here, because in the LGBT movement, I'm born in Shillong, brought up in the Calcutta, but I have my heart is always here in my birthplace. And what I saw in the movement here is something very different. Is that if you see the whole movement, the starting of the movement, Manipur has definitely led the movement when the movement started quite long back, and with the other states coming and joining. But when we saw the first Pride organized, I found that many states joined here, but it was led by women. That was something so amazing to me. I saw so much of women power in this regard, that the rest of India, I saw it was men who took the lead, but here I saw women. That gave me a lot of people allies came together. It made me so really happy, and I feel that we should really come together, because if you really want to, as LGBT, if you're not inclusive in the sense that this means if we keep on telling that we means putting ourselves I and the others, if we don't come together, because I see if you don't allow people, the allies, the different communities, if we don't come together within ourselves, so if we keep on fighting each other, putting each other down, that can never solve the problem. We cannot go ahead. And I feel that this message, I really want to put my feelings, and I'll tell you, I don't want to name any specific state, but I have seen states which a huge potential to do a lot of things, but they lost just for their infighting, putting someone down from the other, instead of coming out of the small egos and everything and coming together. And this is my message to all of you. Means if you don't understand the simple things, because if working for the community, within the community, LGBT as well as outside non-LGBT people, we have to take each other's help. We have to supplement each other. We have to create synergy. If we don't understand the simple thing, and then we'll never be able to come together and bring a great change in the community. So thank you everyone for this year. And if anyone wants to speak, I want that we should not spread negativity. We should spread positive messages, positive vibes. And for me, with lot of hope, whenever I visit Manipur, I go with lot of hope. And sometimes that hope, I want to keep it with that spirit. I don't want to lose it, that everything comes from our thought. The way we see world, the world turns that way. If you are negative, we'll see negative around. But yes, we are fighting for the rights of the community, but we have to be with a very positive mindset. We have to move. And I see so many good examples. And here, I don't want to name, but within now also here also some very good, great examples are there, who had moved out from working for different communities, working out, going beyond LGBT and trying to support and creating a great thing, identity, that it is not only that we and us, and putting a boundary among us. So that is very important, I felt. So all the best. I have taken a lot of time, Sana. So
it's okay.
Let others.
Okay. There is one interesting question also. How do we address the sexuality related health issues in a society where there is no translation word for sexuality? It may be there may not be the appropriate word for the English word sexuality. The same thing is happened to the other linguists also. And but in short, in the Manipuri language is very rich, but few specific words is very outward to translate in Manipuri. Sexuality can be translated in Manipuri as the Haktin Lon, but it may be very derogatory and very outward to say in front of the people, as we are living in a conservative society. And for example, people are not talking about the sexual things and the sexual related topics among the families, among the public also. It's very now it is a taboo, subject of taboo. So we are also finding challenging since in the beginning of the sexual health related events and the awareness programs. Also, people are feeling uncomfortable to attend HIV programs. It was in the 2 decades or 1.5 decades ago, when the Manipur AIDS Control Society was organizing about the HIV and AIDS program awareness. It was very outward to say the routes of transmission of the HIV, but it was open nowadays. People are understand what is the sexual health issues and what is sexual health related, what is sexual health. Sexual health is the one most common issues in nowadays, and people are come forward and they come to understand what is their sexual related health. And so, we have been doing many advocacy, many sensitization workshops in collaboration with many organizations, and it is the fruitful outcome that people are come forward and they came to know the sexuality and the sexual health. It is started already, the discourse on sexual health in many platforms in Manipur also. And so, and is there any questions?
So any other questions from the participants? We don't have any question in the chat, and we don't see anybody raise hands. So we are almost
requested to unmute. If they have any questions, please unmute and ask your questions.
I think cultural imperialism and the linguistic imperialism is also asking about the transgender health and wellness centered role on that. But cultural imperialism, when we talk about the cultural imperialism and the linguistic imperialism, we need to show the evidence, we need to prove that. So we need to do more research on that. In fact, it is happened, and we are in the worsening status. We are in the PT positions that we have to fight. We need to show the proof. For the existence, we need to strongly resist on that. We need to be resist. We need to take a firm position on that, and we need to resist that kind of influence that coming in from the outer external affairs. And we need to show our evidence to the authority. This is other proof. We need to do the more research on this, and this is the initial status and the initial stage of doing that, where we're just giving a platform. Platform is the friendly environment to the community, and as of now we are doing well, but we hope we will be able to do more in the near future also, and we are planning to do things, and we need to ensure right livelihood, cultural, and everything we need to ensure for the well-beingness of the community. But health is also one of the very challenging and the very that kind of issue that community people are facing. Without health, how can we access our given rights? So this is the priority: health, education, and the livelihood, shelter. Everything is important. So we are targeting on the health issues now, and as well as we are targeting to ensure for the wellness and the welfare of the community people. We will cover all those things, but as of now we may not do anything, but in the future we will do many research individually or in the group, in the level of community, and in the level of CBOs, in the level of individual, and we need to give the proof. That's all as of now.
Hello. Hello.
Yes.
Yeah. Just a small observation. My name is Jitin. There was some discussion during the opinions of the resource person or the panelists that as we have been experiencing that the DG communities are much more at risk in Manipur also, and my observations and my comments will be regarding in relation with HIV because in Manipur, as we know that the TG peoples are more at risk of living with HIV, compared to the general population. At the same time, I also believe that the TG people also face, our social and legal exclusion, and also they have the economic vulnerability, and also a lot of there has been an increase rather risks of experiencing violence is happening in the state. And also one of the colleagues from Mizoram also said that HIV related stigma and transphobia also create big barriers in terms of assessing the HIV testing and treatment services by the TG community in the state. So my question to the panelists is that particularly not related with cultural and linguistic imperialism kind of debate, my simple question is that in assessing the HIV services among the trans people, particularly in the state, what are the activities that the transgender centers is going to take up in the coming days? This is I just want to know from the panelists. Thank you.
Let me say something regarding the point discussed. See, I think for the cultural and imperialisms and right-based approach, we can do something. As you know that the Transgender Protection and Rights Bill has been passed by the Parliament and it came to act as a rule. So if I or any individual have faced any crisis, any problem, they can go through the legal aid clinic by individual itself or through CBO. It's not a problem, I think. But those who have no capacity, no empower transgender, we should have them to approach to take the legal help from the legal aid or legal aid service authorities and like that. So, and then regarding the HIV prevention also, HIV prevention and control act also passed. So there will be decreased stigma and discrimination faced by the community in this coming years, I should say, if the bill is properly implemented in the state. So any HIV positive individual can take legal help at the time of crisis regarding his HIV positive status. So right now we are focusing on the health of the transgender plus wellness of the transgender. Yeah, I agree. All kinds of angles of all kinds of issues that faced by the transgender we can do from time to time, but for this time being, we have to focus for the health at heart, and we can do everything. So as you know, our center has inaugurated 25th March this year. It's come to around 2 or 3 months, but unfortunately 2 or 3 months has been imposing lockdown in the state and in the country, so we cannot do anything properly. So we have planned so many things to do in the future. So all the communities, all the say friends and colleagues, I require you all to have at the center what kind of work is doing at the center in particular. So we need to say, I think you will note that at the time of HIV, HIV prevention rising in the state among the MSM and transgender community, the society almost say discriminating us. At the time, we don't know whom should we go, whom should we go to take the legal help and support and all those things. But this time we are very happy. We are very happy. All kinds of rooms is open, their doors. We can approach there. We can help them from there. So I should say again, at the right based approach, we can take the legal at clinic, legal service authority, Manipur legal service authority, or high court, or like that, regarding the issues happen among the transgender community. Likewise, the HIV prevention and control bills act also passed. We should go regarding the HIV status discloseness by the talking the consent of the victim. So we can take every help from the center, all of the setup. So I think other community also asked the related questions regarding the Pride Month also. So this month is Pride Month, and we are very happy to participate in such kind of programs. So regarding the enjoy happiness and the like it, some kinds of pride-ness and proudness that we can take from the society, from the community itself, from the colleague, from the peers, and also ask, I require that we are ready to answer on that. Thank you.
Bonita, would you like to add?
Not at all, but I think Tamo Jiten has asked something regarding the HIV services that we are giving to and we are planning to give to the community. Am I right?
Yeah.
I think Tamo Jiten has asked.
Yes.
Okay.
About the HIV-related service delivery in Health and Wellness Center, I guess.
I just want to know that what is the future kind of course of action that the transgenders community center is going to do in relation with HIV? I just want to know.
Yes. HIV epidemic is one of the issues that the community, the general population, and the community seems to have been forgotten. But it is very challenging issues still we are facing, and it is also life-threatening. But it is safe now. Yes, we will provide those kind of now giving the HIV services to the transgender or the MSM people. It had been provided since many decades, and now it is under somehow it is under control. But as of now, we are also facing many challenges in ensuring HIV services. That there were many misconceptions about the HIV and the transmission, about the HIV, about the ART, about the about those things that relevant with the HIV, and it was kind of subject that people want to hide and run away from this topic, but it is one kind of important thing. So we are also included. This is the composite program we are taking up beyond the HIV program. We are also taken up many measures and many things to ensure the wellness. Not only the health is the one of the subject and one of the things that we have to do for ensuring the wellness also. So in our center we are providing lab test services for the basic needs of the community, and the HIV testing, screening, CBS field-based, community-based screening, and the syphilis test also we are providing. And we are also referral and linkages is one kind of things we are doing for the ART, and the necessary baseline assessment for the initiation of ART. And yeah, we are also giving awareness on the HIV and STI prevention and intervention regarding the intervention and prevention. Because nowadays it is not similar with to compare with the scenario that has happened since in the past 1 decade. Now people are come forward and they are come to know the progressive in treatment. And at the initial people has the misconception and the misbelief that taking ART is making our looks making our looks ugly. It makes our muscles shrinkage, and it make our physical ability down. So this kind of misconception and the wrong information was there, and it may be happen, but nowadays it was totally solved. That's a kind of side effects and all. It's not happen, and we need to give we need to give the accurate information. What is the benefit of early detection and early treatment? If we keep HIV untreated, there might be happen many consequences that more dangerous than the HIV itself.
I think we have no more question in the chat, and no one is raising their hand. So, in many parts of the world, June month is observed worldwide as the Pride Month, dedicated to celebrating the LGBTQI community and their struggle against discrimination and social exclusion. I would like to thank all the 3 panelists on this panel discussion on Northeast LGBTI movement and COVID-19 pandemic and its impact. Over to you, Srinivas.
Hi, Madan, maybe you can thank on behalf of all of us.
Yes, yes.
Yeah. Yes.
Sorry, I had just stepped out. I had just stepped out to have some water. So it was a very enriching discussion, very nicely conducted, Sana and Bonita. Amazing work that is happening in Manipur with this path-breaking transgender health and wellness center. And we at ITech are really, and CDC also, I can say, Dr. Sudhir told me to convey, especially that CDC is also very proud and looking at this activity as one of the flagship activities of Project Sunshine. And we are hoping that this is as Tamo Abhiram says, this is like a candle that will light many more candles in future. So with that, I would like to especially thank the PD madam, under whose guidance and leadership Tamo Abhiram is participating today, and Tamo Abhiram for all the help that you've given now, particularly during the COVID, but even before. In fact, Manipur was the first state or the only state in India last year to have a separate quarantine facilities for the transgender people, and that in itself is a huge feather in the cap for Manipur State AIDS Control Society. In absentia, I would also like to thank our leadership at NACO, who are like always with us. And we've been time and again told that this particular model, because it's sustainable, it's something that is in partnership with the government, is going to be is something that they're looking on upon. And just to give you all a small piece of information, Abhina will now be constantly in touch with NACO from next week. And I'm sure that the model that we are displaying here with Abhina's help and her thought, vision, and leadership, we'll be able to replicate it in other states. Thanks, Abhina and Sanjeev, for leading this. Pankaj, you have been like a continuous, quiet support at the regional office, and it's a great help to Pankaj with such a great experience in the Northeast, who's worked in the field in the Northeast, knows the community very well. Thank you very much, Pankaj, for leading from the front the entire efforts by this small team in Manipur. Thank you all our friends from Nagaland and Mizoram and Manipur. Thank you, Shanta, for your enriching questions, which will always be a guiding light for us. You are like a pioneer in the state, and I'm sure you will remain a guiding light for all of us in future also. And we'll look up to you for any guidance. Thanks, our own iTech backend team for being with us on a Saturday evening. Although both Shweta and Praveen need not have been here, but they're here silently in the background, ensuring that things go smoothly and the entire event is. And just to tell you, they were handling parallel sessions. There was also another session happening at the same time, and they were jumping between this and that. Thank you very much for that. With that, Abhina, I'll request you if, I think Dr. Abhiram is also here, Pankaj is here. I'll thank everybody, and over to you, Abhina or Sanjeev or Madan. Thank you very much.
Thank you, Srinivas. Just one point that I want to highlight after the whole summarization of this today's discussion. Say now, still in Northeast, the problem of stigma is there, and the psychosocial issues, psychosocial problem is there. So definitely this our center, Transgender Health and Wellness Center, will extend its activities in the near future also. But at the same time, what I want to just suggest is that some advocacy films, short films, I think will be very helpful, because Mizoram has rightly pointed out about 80% conservative society, how to face kind of this conservative situation, how we can advocate for our LGBT community. And also at the same time, we can do some kind of documentation of things like, say, Manipur State Legal Services Authority, how they are helping to our trans community, and also how the Women's Commission now they have chipped in all, our program, and where they have already appointed one person as a member of this Women Commission. So like that. So in this situation, I think, and also the situation does not permit the free movement, free gathering, and all that. So at this juncture, if we do have some kind of documentation type of short film type, which can use as a advocacy, number one. Number two, another one is for the mental health problems, how we can cope up with the situation. For that, I think we have so many mental health professionals in Manipur. So we have Dr. Lenin or Dr. Santibla or other psychiatrists who can support this LGBT people in their mental health situation. So like that, such kind of educative film or evocative film, if we can produce maybe short film, maybe 3 minutes, 5 minutes, like that, I think that will also be very helpful. Thank you.
Sure, Tamo. I have taken note of what you have said. I'll work with Shweta here and Divya, and we will look at how soon we can come up with a short advocacy film that will address the issues that you have raised, both of mental health, legal health, not just infectious diseases, but overall well-being issues. At the same time, also keeping in mind the local cultural and contextual dynamics. So I'll revert to you, Tamo.
Okay, thank you. I think Our team are still intact in Manipur, and the situation in Nagaland or Mizoram, that I don't know exactly, but they are also doing well during this period. No, what last time also Sanamacha and the whole team in Maruploi, they work, uh, run here and there just to supplement their nutritious food or something like that to help in their livelihood. So I think uh, when this pandemic becomes some slow down, then at the time we can think of some taking up some activities on livelihood issues also, because now all the parlors, beauty parlors, has been all run down, and the cultural activities or the marriage ceremony or any this kind of activities has also totally stopped. That's why our trans community people who are doing this parlor and all that totally stopped. Means it is loss of livelihood and all that. So we need to look at these areas also, as well as we can strengthen our activities to prevent HIV also, because in our hand still say WHO or UNH or India government has put 2030 as a this final goal, but beforehand also we can take up various activities. That's why always we are discussing on the, even Jiten also asking what are the activities in relation to the HIV/AIDS and like that. That will not forget. But at the same time, we need to take up some other issues also. That's all. Thank you.
Thanks, Tamo. Yes, you are absolutely right. We will definitely. Also, I hope that very soon travel resumes and we are able to once again start our visits to Manipur and seek guidance from the community leaders, from friends from the community, and from SACs on how we should take it forward. Just to, I mean, just to sum up, this is like a dream. This project was like a dream for a lot of us. Pankaj and I, Sanjeev, even during sunrise time, we used to discuss how to do it. We tried doing it in Maharashtra, AP, but we were unsuccessful. We were stumbling in all these places. And I remember the time when I had come down to Manipur just before the first lockdown and met Sana just to get her idea on this. This was during the sunrise days. And finally, thanks to Abhina, Sanjeev, the model came up and Maruplai took it forward. And so now we have to go next step with your guidance, Tamo. Thanks.
Thank you.
Thank you, sir. Pankaj, you want to have a last say? Anything you want to say?
Thank you, Srinivas. So my last word is that this very initial stage, like this organize means this concept is in the baby stage. Only few months has happened. So the team has done the level based, and while we are having a program and while we are having implementing a program with the donor supports, there is always some these things. We have some targets, we have some things to deliver, but at the same time what I understand, there are many things, there are a lot of opportunities what we have now to take it forward with this health and wellness center. This is just an initiatives with the help of everyone, whoever is here. Everyone has contributed whatever ways they can, and with the support of that, these initiatives has happened. And today is the first day while we are having we are bringing the TZ friends together, and we are just behind to understand what is their opinion, what is their what kind of feedback they are giving. So that will help us to build a strategies to doing the advocacy with different policy level, and what kind of other these things opportunity we have. So many things has come up in the chat box also. Thanks to Santa for putting some questions. So that has put us some lights on our thoughts. And everybody, I request everyone to extend your support. This is not just an Maruploy things, or not just an MSEX things, not just an ITEC and CDCs things. This is a model this is a platform which is created, and that will really going. I really want everyone to support and everyone come together as a community to support the communities. And we people are behind only. You people have to take it forward, and there are many things we can do it. What I understand from today's discussion, this is the initial discussions, and I will assure you that on a regular basis and regular interval we'll trying to bring many people here, as Tamu suggested, that we can bring out the policy level decision makers into this kind of webinars with front to front. You can talk with them and you can put your thoughts forward, and how the community can be benefited with the different department, with the society, and and political these things, political commitments. So this is just an initiatives, and I hope from here we're starting the journey of discussions. We are starting the journey of advocacy, as Srinivas has already told Tamo Abhiram, that we will definitely find it out with our central team for advocacy kind of clips. That's really very good thoughts, Tamo, you have shared. And last but not the least, I thanks from my bottom of heart to everyone who have participated today, and our small teams led by Bonita. Thank you, Bonita, for your these things, leaderships, and Ranjit, and with our state team and all our stakeholders, and especially Tamo Abhiram. Without your help, these things is not going to happen. So we always looking forward your support. Thank you very much. Thank you, everyone.
Thank you. Thank you.
Thank you, sir. So we have come at the end of the event. So with the permission of the chairperson, Sarah Abhiram, so we are ending today's event. And on 27, as part of the Pride Month celebration, we have beauty pageant for selecting the community champion from trans men and trans women. So from the on behalf of ITEC, on behalf of Maruploy, and on behalf of community leaders, and to Sarah Abhiram also, we would be needing your support to make this a grand success. So hoping that all the participants, all the community leaders will join for this program on 27th. So thank you, everyone. So happy weekend, and let's see you on 27th of June. Thank you.
Thank you.
Thank you, everybody. Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Everyone.
Let's enjoy this Pride Month. Joseph.
Thank you.
Stay safe.
Bye.
Bye. Bye-bye.